But the one thing is, which is really not getting better and perhaps is worse off, is the kind of pollution levels that you're seeing in cities like Mumbai. The AQI levels definitely have deteriorated quite a fair bit. In fact, it was a count of almost 180 on an average. That's what we've been clocking on the AQI index all through this week. Now, why this deterioration, you would ask? Because, AQI, air pollution, these are things which are very akin to cities like a Kolkata or a Delhi for that matter, which grapple with high AQI levels at the same time all throughout the year. But you've seen slower wind speeds and that are increasing also the pace of smog spread ahead of the winters. It is a low pressure time right now in Mumbai. And also remember, Mumbai has seen a huge spike in the last 1 year in the construction activity as well. So that also is leading to a fair amount of air pollution. And of course, vehicular pollution, we all know how bad it has been out there. So let's try and understand what it does really mean for you and me, and how is it that we can prevent damage from these high AQI levels. We have Dr. Arvind Kumar, the chairman at Institute of Chest Surgery at Medanta Hospital, joining in on the show right now. Dr. Kumar, thank you so much for taking the time out from your busy schedule. And like I was just saying in my opening remarks, that us Mumbaikas are not really used to high AQI levels. The sea breeze used to save a lot of damage for us. It was very akin to Mumbai, to Delhi, but we're facing very high AQI levels. Help us understand what is the near-term and the long-term damage then it could do to everyone's lungs.
First of all, Aisha, thanks to you and to ET Now for having me on this show. And as you said, for the past couple of decades, Mumbaikars and Mumbai had been lucky in the sense that sea had often been coming to your rescue and had been kind of clearing the air to quite an extent. And up till now, pollution was considered a North India centric problem. But first of all, let me inform viewers that 98% of the surface area of our country at present suffers from very toxic levels of air pollution. So if anyone in any part of the country where at least the optical quality of air is good thinks that air is not polluted, you are wrong. Air across the country, it may vary from city to city. Sometimes north is bad, sometimes other areas, but it's a problem across the country. Now, coming to health damage, air pollution is primarily a health issue. I would summarize in just 2-3 minutes. What is the health ill effect of air pollution? So first question is, at what age does it start affecting us? And the saddest news which I have to share with listeners and viewers is that it starts affecting even the baby being inside a pregnant woman's uterus. There is data now to show that air pollution doesn't wait for us to be born. When a pregnant mother breathes in toxic air, the chemicals go from the lung into her blood and through the placenta to the uterus, to the fetus in the uterus, and intrauterine growth retardation, a lot of congenital defects, premature delivery, intrauterine death, and a lot of problems around the pregnancy time in the child are all established known problems now in these people. After birth, these children have very high chance of developing what is called bronchiolitis, which is akin to asthma attacks in the adults. And this continues in the first 5 years of life. Exposure to high air pollution levels, it's the commonest cause of pneumonia and pneumonia-related deaths in under 5 children, as also the cause of cancers in this group. There is data now to show that once it enters the lung, it goes to every part of the body from brain to toe. And there is data to show that it affects IQ development in children, it affects lung development, it causes premature hypertension, it causes in adults heart attacks and brain attacks, it increases the risk of COPD and cancers in the adults. And most important is that there is no organ in the body which is spared the ill effects of air pollution. Additionally, nearly 7 million deaths are being caused prematurely. There's a data which came out from University of Chicago recently. They did extensive study across India, and they have said that in North India, on an average, each person loses about 8 to 10 years of their life because of the exposure to air pollution, which basically means if the air was clean here, each person in North would live about 8 to 10 years longer. So air pollution is primarily a health issue, affecting our health as well as the health of our children, the most loved ones. Aisha.
Sure, absolutely, Dr. Kumar. Thanks for setting the base. But what can be done? Because, kids can't even go about wearing masks. I mean, is an N95 mask the solution? We obviously can't leave your livelihoods and, move cities at this juncture. What do we do? Do you put air purifiers? Do they really help?
Aisha, let me make some very bold and maybe little unpleasant statements. People may not like it. Air pollution is a problem of environment. Air does not know any boundaries, and unlike water and food, which we can take at will, and if unclean water and unclean food is there, we can wait for clean water and clean food. Air is a 24 by 7 by whole life necessity. We cannot stop breathing for more than a minute to minute and a half. And therefore, temporary things like air purifier, masks, etc., are not a solution to air pollution. Anyone who wishes to propose masks as a solution to air pollution, no, we cannot, the whole country cannot be wearing masks 24 by 7 by whole of their life. It's not possible. And therefore, these are only very, very temporary measures, which we say if the levels are acutely high, well, if you have to go out, put on an N95. It will give you a temporary protection only as long as the mask is there and as long as it is properly fitting, which means no air goes from the side. Similarly, air purifier only helps as long as you are inside a closed room with a good quality air purifier. And air purifier also, the filters need to be changed regularly, which 99% of the people do not do. And oftentimes, instead of purifier, they actually become dirty fire. This is the reality which I'm informing you because I deal with this topic every day. So please, masks and air purifier are not a solution. All of us have to get together and see it as an emergency, even bigger than COVID emergency, and take immediate measures to reduce the causes of air pollution, which is increasing vehicular traffic,
Sure.
unrestricted construction, and dust going out freely from our construction site, which is something you see only in our country and not everywhere else.
Thank you so much for taking time out and really putting those very disturbing statistics to light.